Okay, hi, my name is Brittany. I'm going to be your nurse today. I'm just going to do some hand hygiene. Can you please tell me your first and last name?
Kaylee Yagler.
Okay, and where are you today?
I'm at the doctor's office.
And what are we doing?
We are in assessment.
Yeah. Okay, and who's the president?
Joe Biden.
Okay, so I'm just going to take some vitals real quick. Can you hold out your arm for me? Actually, I'm going to just roll this up. You can relax your arm. Just gonna... Okay, 128/82. Now I'm just gonna take your pulse. I'm just gonna crouch down with you. You can rest your hand. I'm just gonna retake it again. Okay, so your pulse and respirations are, excuse me, good. And I am just gonna ask, what's your height and weight?
I'm 5'7" and I'm about 155.
Great, okay. And what's your pain level at today, out of a 0 out of 10?
0.
Okay, so I am going to start off by just inspecting and palpating your head and hair. So first, I'm just gonna look through your hair. Excuse me. Could you uncross your legs for me? Okay. Great. I'm just gonna palpate around your head. Everything feels normal. Have you been having any issues with your skin lately?
Not really.
Okay. Could you please squint your eyes for me? Great. And then could you frown and smile? And then could you puff up your cheeks like, okay, great. Now I'm just going to palpate your temporal artery. That's great, it's 2+. Okay, now could you, I'm gonna go ahead and feel this. Could you please clench your jaw? Okay, and then could you open and close your jaw a few times? Great, there's no popping. So now I'm just going to palpate your sinuses. Let me know if you have any pain. Okay. Great. Now, I'm just gonna look at your eyes. Sorry. Okay. Your eyes, there's no swelling, your sclera looks white. and your pupils are equal. I'm going to go ahead and have you look past me. I'm just going to shine a light in both eyes to see your pupil dilation. Great. Great. Now could you just look at the tip of the pen light and just follow it for me? And try not to move your head with it. Great. Great. Okay, now I'm just gonna have you look at the tip of the pen. I'm gonna put it all the way to your nose and just go ahead and follow it. It's gonna make you go cross-eyed, okay? Okay, great. So now I am going to inspect and palpate your ears. I don't have a something to look inside the ears, so I'm just going to pretend, but first I'm going to look at the ears. There's no redness or swelling or abnormalities. Everything looks good. I'm just gonna feel that bone. Let me know if you have any pain while I'm touching you, okay?
Mm-hmm.
Just gonna do that. Great. And if I were to inspect inside the ear with the appropriate device, I would pull the pinna up and back and look at the eardrum and look at the cone of light, which would be at 5 and 7. And the eardrum should be pink and healthy looking. Okay, so now I'm going to cover one of your ears and I'm going to whisper. I just want you to tell me what you hear.
Dog cat.
Okay.
Apple banana.
Great. Okay, so now I am going to look inside your nose. First I'm gonna just do some hand hygiene and some gloves since I'm gonna be kind of getting in your nose. And I'll have you go ahead and look back. Everything actually is looking pretty good. Have you been having any issues with your nose lately?
I had a cold recently, so I've had a little bit of a stuffy nose, but I'm just about over it.
Okay, looks good. And then I'm just gonna actually look inside your mouth as well. Please open up. Okay, everything looks good. Pink. Sorry. Moist. Could you stick your tongue out for me? And then could you move your tongue side to side? Great. Okay. Going to remove gloves and perform hand hygiene. And could you just close your eyes? I'm gonna have you smell something and just let me know what the smell is. What's that smell?
Alcohol.
Great, okay. So now I'm just going to palpate your lymph nodes around your neck. Let me know if you have any pain or discomfort. Okay, no, there's no swelling or anything like that, so that's great. I'm going to feel your carotid pulses one at a time. Sorry. Great. I'm just gonna listen for the carotid pulse as well. Okay. Great. Okay, and now, I am going to inspect and palpate the pulses on your arms. So I'm just going to feel, sorry, I'm gonna lift this up for you. I'm gonna feel your brachial artery, or your brachial pulses. Great, I'm gonna feel your radial pulses. Great, they're all equal. And so far all your pulses are 2+. So now I'm gonna look at your skin. Your finger, please. I'm gonna look at skin turgor. Looks good. And then look at capillary refill. Good. This side. Everything is about 2 seconds, which is great. I am I'm going to have you, could you please squeeze my fingers for me as strong as you can? Great, okay. Now I'm gonna, if you actually could stand for me, I'm gonna look at your range of motion. Could you shrug? Great, okay, and then could you push your arms forward, back, up, and then side to side, and can you flex and extend? Great, okay, and I'm gonna actually have you, excuse me, I'm gonna have you stand here and I'm gonna have you close your eyes and hold your arms out. Great, okay, and now I'm just gonna have you lay down and I'm gonna look at some other stuff. And I'm gonna actually have you sit at the edge of the bed for me, sorry. First, I'm just gonna listen to your lungs. Have you been having any issues with breathing or anything like that with your cold?
Not really.
Okay. So I'm just gonna have you take a deep breath in and out. Breathe in and out. Okay, and I'm gonna listen to your back breathing sounds. Okay, in and out. Okay, everything sounds clear and equal, so that's really great. Now I'm just gonna listen to your heart. Probably should have kept these on. It's okay. Okay. Just gonna go second intercostal space. Great, all of your heart sounds sound great. There's no issues or abnormal sounds. Now I'm gonna have you lay back. Okay, are you comfortable?
Mm-hmm.
Okay, I'm just gonna listen to your bowel sounds first. Do you mind if I lift up your shirt?
Mm-hmm.
Just gonna look. All right, everything looks equal. I'm gonna first auscultate. Okay. I'm gonna auscultate. Okay, and now everything sounds normal. Your lung sounds, bowel sounds all sound great. I'm gonna palpate. Let me know if you have any tenderness. Okay. All right, everything looks great. So now I'm just going to, could you lay your legs down for me? We're gonna do the same thing with your arms. I'm just gonna have you push your legs up against some resistance. A little bit, one more time. Great. And then I'm gonna test your nerve down here. This is gonna tickle a bit. Okay. And then, sorry, could you sit up for me? And can you hold your arms out and try to push up against resistance? And then put your arms like this, and you're gonna pull towards you. Okay, now push towards me. Great. Now I'm gonna actually have you stand up and I'm gonna inspect your back, and then we'll just have a couple questions. Here, I'll have you turn around for me. Okay. This is when I would have her remove her shirt and I would inspect the back for any abnormalities, but everything looks equal and bilateral on both sides. Now I'm going to palpate down the spine. Okay. All right, I'm just going to percuss. Okay, and then I'm gonna have you go like this, and could you just bend all the way down for me? Great. And then could you extend to the side on both sides? Any pain or discomfort while you're doing that? Okay, I'll have you sit and we'll just ask a couple questions. Are you having any areas of concern with your skin or anything like that?
Not really.
How about your reproductive system? Are you having any issues? I saw that you got an IUD placed recently.
Yes, since that I've just had heavier periods and more cramping, but other than that.
Is the cramping something that you need to like switch your birth control with, or is it something that you can tolerate?
It's more tolerable than other birth controls.
Do you take any over-the-counter medications for it, for the pain?
Just Tylenol, ibuprofen, stuff like that.
Okay, so that all sounds good. I'll let your doctor know that you are experiencing a little bit of discomfort and additional bleeding, and if needed, you guys can go ahead and talk about some different options if you'd like to.
Okay.